Question number 1. What is the safest nursing intervention with withdrawing blood from a central venous catheter? The correct answer is option C. Use steroid normal saline for flushing. Question number 2. Which cardiac medication requires a nurse to check the apical pulse for 1 full minute before administration? The correct answer is option B. Digoxin. Question number 3. When should a nurse immediately discontinue a blood transfusion during infusion? The correct answer is option B. When rash and hypotension appear. Question number 4. Which isolation precaution is essential for a patient with varicella zoster chickenpox? The correct answer is option C. Airborne and contact. Question number 5. What is the most accurate method for verifying nasogastric tube placement before feeding? The correct answer is option A. Checking gastric pH. Question number 6. Which nursing action prevents ventilator-associated pneumonia most effectively? The correct answer is option A. Performing oral care with chlorhexidine. Question number 7. What is the most important nursing assessment after epidural anesthesia? The correct answer is option A. Respiratory rate and effort. Question number 8. Which hormone is responsible for sodium reabsorption in the renal tubules? The correct answer is option B. Aldosterone. Question number 9. What is the best nursing response when a patient on lithium therapy report excessive thirst and urination? The correct answer is option B. Notify the healthcare provider immediately. Question number 10. Which nursing intervention prevents hypokalemia in patients receiving loop diuretics? The correct answer is option A. Encourage potassium-rich foods. Question number 11. What is the earliest clinical sign of hypovolemic shock? The correct answer is option B. Increased heart rate. Question number 12. Which nursing measure reduce the risk of catheter-associated urinary tract infection? The correct answer is option A. Keep drainage bag below bladder level. Question number 13. When should a nurse administer peak insulin after giving irregular insulin injection? The correct answer is option C. 30 to 60 minutes after injection. Question number 14. Which diagnostic test confirmed tuberculosis infection in a patient? The correct answer is option B. Mentox scan test. Question number 15. What nursing action is most appropriate when a patient develops dyspnea during blood transfusion? The correct answer is option A. Stop transfusion immediately. Question number 16. Which nutrient is vital for collagen formation and wound healing? The correct answer is option B. Vitamin C. Question number 17. What should the nurse monitor closely in a patient receiving intravenous mannitol? The correct answer is option A. Urine output and serum osmolality. Question number 18. Which nursing assessment finding indicate digoxin toxicity? The correct answer is option B. Nausea and yellow vision. Question number 19. When performing CPR, what is the correct chest compression to ventilation ratio for an adult? The correct answer is option C, 30:2. Question number 20. Which nursing measure is crucial when caring for a patient with increased intracranial pressure (ICP)? The correct answer is option B, elevate head of bed 30 degrees. Question number 21. What nursing action is most appropriate when inserting a urinary catheter in a female patient? The correct answer is option A, maintain sterile technique throughout the procedure. Question number 22. Which electrolyte imbalance is associated with platelet T waves on an ECG? The correct answer is option B, hypokalemia. Question number 23. When should the nurse collect a sputum specimen for accurate culture results? The correct answer is option B, before breakfast. Question number 24. Which nursing measure prevents pressure ulcer development in a bedridden patient? The correct answer is option B, turn the patient every 2 hours. Question number 25. What is the best nursing intervention during seizure activity? The correct answer is option C, turn the patient to side and protect head. Question number 26. Which nursing absorption indicates fluid overload in an IV infused patient? The correct answer is option B, critical in lungs and edema. Question number 27. When caring for a post-operative patient, what is the most reliable indicator of pain? The correct answer is option C, patient's verbal report. Question number 28. Which type of isolation is required for a patient with Clostridium difficile infection? The correct answer is option B, contact. Question number 29. What should the nurse assess first when a patient suddenly becomes short of breath? The correct answer is option A, oxygen saturation. Question number 30. Which nursing intervention is essential before administering morphine sulfate? The correct answer is option A, assess level of consciousness and respiratory rate. Question number 31. What is the most important nursing responsibility during blood transfusion? The correct answer is option A, verify patient identity and blood compatibility. Question number 32. Which nursing assessment finding suggest hypoglycemia in a diabetic patient? The correct answer is option B, shakiness and sweating. Question number 33. What nursing intervention prevents aspiration in a patient with nasogastric feeding? The correct answer is option A, keep head of bed elevated 30 to 45 degrees. Question number 34. When should the nurse wear an N95 respirator mask? The correct answer is option B, when caring for a patient with tuberculosis. Question number 35. Which nursing intervention minimizes phantom limb pain after amputation? The correct answer is option C, encouraging use of mirror therapy. Question number 36. What should a nurse check before administering digoxin to a cardiac patient? The correct answer is option B, apical pulse for 1 full minute. Question number 37. Which nursing measure ensures patient safety during oxygen therapy? The correct answer is option A, keep oxygen cylinders away from flames. Question number 38. When assessing a patient with right-sided Heart failure. What sign is most typical? The correct answer is option B, jugular vein distension. Question number 39. Which nursing action prevents medication errors effectively? The correct answer is option A, follow the 7 rights of medication administration. Question number 40. What is the safest position for a patient after spinal anesthesia? The correct answer is option D, semi-Fowler's position. Question number 41. What is the most appropriate nursing action when a patient develops shortness of breath during IV infusion? The correct answer is option A, stop the infusion immediately. Question number 42. Which electrolyte imbalance most commonly results from excessive use of loop diuretics? The correct answer is option B, hypokalemia. Question number 43. When should a nurse use the Trendelenburg position for a patient? The correct answer is option B, in hypovolemic shock. Question number 44. Which nursing step ensures accuracy when administering insulin mixtures? The correct answer is option A, draw the clear insulin before cloudy. Question number 45. What is the safest nursing measure when applying a heart compress? The correct answer is option C, use a barrier between compress and skin. Question number 46. Which nursing assessment finding requires immediate action after spinal anesthesia? The correct answer is option C, difficulty breathing. Question number 47. What is the nurse's first response when a patient experiences sudden chest pain? The correct answer is option B, assess pain intensity. Question number 48. When caring for a patient on oxygen therapy, which precautions should a nurse follow strictly? The correct answer is option A, avoid petroleum-based products. Question number 49. Which nursing intervention best prevents ventilator-associated pneumonia? The correct answer is option A, frequent oral care with chlorhexidine. Question number 50. What should a nurse monitor first after administering intravenous potassium? The correct answer is option B, cardiac rhythm.